Vitamin D3. It's been in the news more, and doctors are becoming more active about testing their patients for vitamin D3 deficiencies. So what's going on? Here's the thing. Your body creates vitamin D3 naturally. It creates it using your skin's exposure to the ultraviolet light that you get in sunlight. But here in the US, because of where our country sits on the planet's face, we simply don't get enough sunlight to allow you to really produce the level of vitamin D3 that you need for optimal health. In fact, any of the countries sitting above that 38-degree latitude just don't get the amount of sunlight needed. Why? Okay, low tech. Here's the sun and the earth with a little belt around it called the equator, which cuts the earth in half, creating your upper and lower hemispheres. And now remember from your 6th grade science class that the earth doesn't sit just straight up and down. No, it tilts on its axis. Well, when you look, you notice that the sun gets to that lower hemisphere below the 38-degree latitude a lot quicker, doesn't it, than it does up top, which is where we are. Now, it takes longer for the sun's rays to get to us, which now means that the sunlight simply isn't as strong. Okay, why should you care? What does vitamin 3 actually do for you? Well, your immune system, specifically your T cells, actually have receptors on them for vitamin D3. They are looking for vitamin D3 to keep them strong, allowing them to fight off disease. Vitamin D3 also boosts calcium deposits in your bone, making it important for strong bones and skeletal growth. Many patients with chronic muscle aches and pains and fibromyalgia were found to be vitamin D3 deficient. In fact, they did a study which followed the health of 130,000 nurses for 3 decades, and that study found that vitamin D3 supplementation reduced the risk of multiple sclerosis by 40%. It's also essential for your cardiovascular health. In fact, high blood pressure has been linked to those who are living in those higher latitudes. African Americans and all people with darker toned skin need significantly more sunlight exposure to even produce enough vitamin D3. Why? This is because darker skin contains more melanin. That's the pigment that gives skin its color. And the higher the melanin content in darker skin tones, this now acts like a sunblock and completely reduces your ability to manufacture vitamin D3. Throughout the US, it's estimated that as high as 50 to 75% of African Americans are vitamin D3 deficient. Can you see now the tie-in with cardiovascular health? One study also found that vitamin D3 supplementation can reduce the risk of getting the autoimmune disease type-2 diabetes by a whopping 80%. So it's important that you speak to your doctor or healthcare professional about having your vitamin D3 levels regularly tested. So we'll talk about more ways to keep yourself healthy in other segments. And also you can always click on earlier segments to learn more. So stay tuned. I'm Jeanne with New Day Holistic Health.